It's January, and you know what that means. Pretty much all of us make that resolution to exercise more, get in shape, but unfortunately with those resolutions comes a lot of injuries. Our bodies just aren't used to all of that. So, University Healthcare to the rescue to prevent those injuries. We have Dr. Stuart Willick here with us. He is at the Spine Center at the University of Utah's Orthopedic Center. How are you this morning?
I'm very well, thank you for having me.
Well, we're really glad to have you here. So first of all, I want to talk about some of the most common injuries. What are you seeing right now, especially in January?
Well, the injuries we see are somewhat seasonal. So in the winter, we're going to see more acute traumatic injuries in skiers and snowboarders. In the springtime, we start seeing more overuse injuries, or people are starting to run and bike more, and those are more gradual onset type injuries.
Are there warning signs before the injury happens, whether you're on the ski slopes or you're in the gym?
Well, at times there are, and at times there aren't. If you ski into a tree, there's not going to be a lot of warning signs for you. But if you're starting a new running program or a new cycling program or picking up tennis, there can be warning signs, some of which you might pick up on and some of which you might not pick up on. Certainly, if you're starting to have a decrease in performance, that would be a warning sign that a muscle or tendon is being overloaded. Certainly, if you're having pain or swelling, that's a warning sign that a muscle or tendon or joint is being overloaded.
The best way to not have an injury is to prevent it, right? Prevent those injuries. How could you do a little bit of prevention when you're starting a sport?
That's a great question, and I try not to use the term injury prevention so much as injury reduction, because if you're participating in athletics, there's always the risk of injury. You can't reduce it to zero, but we do want to minimize it, and the ways to minimize it are several. One is you want to do adequate training before picking up a new activity, and when you pick up a new activity, you want to start slowly and gradually and not increase it too soon. If you're 16, you may be able to go out and run 6 miles without training for it, but when you're 36, it becomes hard to do. You want to maintain adequate flexibility, adequate strength, adequate motor control and coordination. You want to use the proper technique for that sport, and you want to use the proper equipment for that sport. And all those types of things will decrease injury rates.
I have a question. Okay, so say, for example, you hurt your back, you hurt your knee. Do you go ice? Do you go heat? And at what point do you call you and say, I need some help?
Yeah. For minor aches and pains, you don't have to go running to a doctor or a physical therapist. For an acute injury, if you strain something or sprain something, we always recommend ice.
Okay.
Ice will decrease pain, decrease blood flow to an area, decrease swelling in an area. For deep structures like the back, neither ice nor heat is really going to get that deep. But for superficial structures like a wrist or a knee or an ankle, ice can be very effective at controlling pain and controlling swelling.
How do you know when to use heat and when to use ice?
Again, for the first 48 to 72 hours after an acute injury, you always want to ice. In the more subacute or chronic settings, then it's more what feels good than either ice or heat. But in general, for acute injuries, we're always going to recommend ice, not heat.
Ice first. I never knew that, so that's good to know.
Yes.
All right, so if you injure yourself, maybe you've never skied before and you decide to take that black diamond run, like an idiot, like I would do probably, and you need some help, the Utah Orthopedic Center up at University Healthcare is the place to go. The number there is 587-7109. You can also log on to the website, healthcare.utah.edu, to get more information. And Dr. Stuart Willick, thank you for the great information and keeping us healthy this year.
Thank you very much for having me.
Thanks.
All right, coming up next, our favorite